The United States Preventative Service Task Force says every adult in this country should be tested for depression. The findings were just published in a recent issue of the Journal of the American Medical Association. So joining me now to talk about this, Dr. George Pratt, psychologist at Scripps Health. Good morning, doctor.
How are you, Lisa?
Good to see you. Thank you for coming in. Okay, so when I read this in the journal, I thought, wow, that's a radical idea. Every person over the age of 18 needs to be screened for depression. Is that really a radical idea, or is it needed?
It has been needed for a long time. It's actually a wonderful development. What we know with women that are pregnant or postpartum, there's about 9 to 13% when they're pregnant are suffering from clinical depression, and about 10% postpartum. So if you can identify those people that need help, you can save tremendous problems. You can rescue them so that they can think about getting some treatment with a psychologist or a psychiatrist or other mental health provider.
Okay, we're not just talking about pregnant women, though. We're talking about any adult over the age of 18.
Right.
What does the study suggest? How would the process work?
Well, there would be a 10-item questionnaire that you would complete in your physician's office.
So just like when I go to the doctor because I have a sore throat, this questionnaire would be brought up?
Right.
Okay.
So it takes a couple minutes, not even a couple minutes to complete. The doctor would look at it, identify that there's some problem, ask them about it. 10 years ago, they didn't want to ask them because they thought it would make things worse.
So what changed?
I think just a greater awareness. There were a lot of people suffering from clinical depression that weren't getting help. And if people are clinically depressed, that tremendously affects their ability to be a good mother. Clinically depressed women do not take good care of themselves typically, and they don't take very good care of their babies. So you're really doing some wonderful things by identifying someone that's in need.
Now, but doctor, the cost associated with this, I would imagine, to the person. So say, you know, I went in and I had a sore throat. My doctor asked me these questions, and the doctor says, oh, you scored that you would be depressed. So then all of a sudden the cost would be incurred on me to go and get follow-up care.
Well, if they're going to refer you, it's probably covered under your health plan. And so what happens is if you don't get help and you're clinically depressed, that affects not only you, let's say if you've just had a child, your care for the child, the whole family, and then there's huge repercussions. And they don't tend to get better by themselves. It's not like the baby blues that usually clear in about 2 weeks. This is something more substantial where they're having problems with sadness, concentration, memory. Many physical problems are also related to depression, headaches and backaches, and just loss of happiness.
Enjoyment of life too. So now, is this going to, this is just a recommendation at this point. This is not kind of a mandate. So, you know, when you go to the doctor or somebody watching at home goes to the doctor, this isn't going to happen just yet, correct?
Correct.
Okay.
So this just got published in the Journal of the American Medical Association just very recently. So you can plan that this will be implemented, and this will be terrific to help people prevent major depression.
Well, and we know, of course, mental health is one of the biggest issues facing our country, one of those hot button issues that everybody talks about. Doctor, thank you so much for your time and for explaining this all to us this morning.
My pleasure.
We appreciate it.